Thanks for tuning in to Sleep Better TV. I'm Scott Drake. My guest today is Dr. Blake Perkins with Dental Sleep Medicine of Vancouver, Washington, and we're talking about the symptoms and the treatment of obstructive sleep apnea and other sleep breathing disorders. Dr. Perkins, welcome and thanks for talking with us today. How does a dentist treat OSA?
Well, one of the most important things we have to do, first of all, is get a proper diagnosis of what type of sleep apnea this person would have, whether it's mild, moderate, or severe sleep apnea, and then treat accordingly.
And what are some of the other treatment options?
Well, the biggest thing a dentist can do to treat obstructive sleep apnea is to make what's called a mandibular advancement device, which moves the lower jaw forward during sleep, allowing for the airway to open and get the air in that the patient needs.
So Dr. Perkins, can you talk about the sleep test and how that's performed?
Well, there are a few different kinds of sleep tests that can be done. There's either a polysomnogram, which is also referred to as a PSG, and a home sleep test, or HST. The polysomnogram involves placing different kind of electrical leads on the head, as well as effort belts around the abdomen and the chest. And measures all sorts of different things from brain waves to heart rate. There's a pulse oximetry sensor that's placed on the finger that also measures the oxygenation of the blood. And they gather information from heartbeat, heart rate, all the way to movements of limbs and even movements of facial muscles during sleep. The home sleep test is a much simpler test that basically measures breathing, heart rate, oxygenation of the blood, and the effort that is made when you're breathing. And it's consisted basically of a small box that is placed on the chest, some elastic belts that go around the chest and the abdomen, and what they call a nasal cannula, which goes up over the ears and in the nose, as well as, again, a pulse oximetry sensor that goes on the finger. And those are combined to make some simple measurements of breathing and heart rate and oxygenation, as well as the effort that it takes when the apneas occur.
Now, so as a dentist, you're talking about prescribing an appliance, a custom-made appliance. Compare that to using CPAP.
Using a dental appliance to treat sleep apnea opens the airway physically and mechanically by bringing the lower jaw forward, which also, because the tongue is attached to everything with the lower jaw, the tongue comes forward as well, and that helps to open the airway, versus a CPAP machine or a BiPAP, which blows air through the nose or mouth and physically opens the airway by air pressure.
Finally, with the appliance, does insurance cover it?
Most of the time, an appliance is covered by insurance. Sometimes you will find a copay involved, but it is considered for mild to moderate sleep apnea a first-line treatment as effective as a CPAP machine.
All right, Dr. Perkins, thanks again.
You're welcome.
My guest has been Dr. Blake Perkins with Dental Sleep Medicine of Vancouver, Washington, and you're watching Sleep Better TV.